Hello, this is Terence Russo. I'm chair of the Healthcare Information Technology Group at Garfunkel Wild, and welcome to the Garfunkel Wild PC Healthcare IT podcast. Today, I'm here with Phil Hammarberg, who is head of Garfunkel Wild's Intellectual Property Group, and we're here to discuss some of the scary new spyware out there and the zero-click hack risk. So, Phil, thanks for joining today.
Thank you. So first, I guess, why don't I start by talking about some background related to smartphone hacking and I guess hacking in general. Most people view hacking as a very high-tech process, and it certainly can be. But generally speaking, most hacking is commonly done by tricking people. Tricking people to click links or to download something in order to inject a virus or malware into their IT system, or for the purposes of this conversation, a smartphone. It's typically easier for hackers to trick a person than it is for hackers to defeat sophisticated technical safeguards and firewalls.
Yeah, the weakest link in my experience is generally the human factor, and humans who fall for social media scams or any phone calls, all sorts of tricks. But this one is a little different, isn't it?
It is. So a zero-click hack or exploit is sort of the one exception to that rule. A zero-click exploit, unlike typical hacks, are generally not preventable until the provider of the software or the smartphone patches it or corrects the software. An example of a recent and very concerning zero-click exploit was the Pegasus Spyware software that was used and directed to iPhones. Pegasus spyware was capable of infecting any iPhone until the software was patched by Apple in a way that prevented this spyware.
I've been reading a lot about Pegasus spyware in all the papers. I even saw an article in the journal yesterday. So, and I know it was international, maybe developed by an Israeli spyware company. But how long has this been out there, Phil?
So, based on the publicly available information, it's been out there at least 9 months. It could go back a lot longer than that, but I think that's when it really started to become public, or at least that they're able to track this spyware back to, the spring of this year.
Got it. I've read, it's definitely been in the news a lot recently. I think I even heard of some cases they thought it's been around since 2016, which is kind of scary because I always thought everyone always told me my Apple iPhone was pretty darn secure.
That was definitely the common belief, and it probably is pretty secure. But even though iPhones, were the gold standard of, secure smartphones, no security system on an IT device is perfect. There will always be loopholes and exploits and vulnerabilities that come about, and hackers are working 24/7 to devise new ways to get into IT systems.
It's kind of scary. It's a war. You come up with a better security system, and the hacker thinks of finds a better way in. So what are some of the things? Some of the takeaways.
So I think bringing this back to sort of the healthcare IT space and healthcare IT agreements, I think it's important to ensure that vendors will promptly patch and update their software the moment that they become aware of these vulnerabilities. I also think it's very important to have appropriate warranties and data security terms so that at least that the vendor is using industry best practices. And then finally, I think it's really important to have an appropriate limitation of liability based on the type of data, the scope of the data, and how it's being hosted or stored.
That makes a lot. That's one of my favorite topics: appropriate limitations of liability. Just for the listeners out there, sometimes when you click and you use an app, the vendor's saying, hey, if anything happens, there's a data breach, I'm not liable. So you have to be aware that sometimes that happens, especially the click wrap terms. Almost everyone, that's actually the default where they try to disclaim all responsibility. So in terms of if you're a healthcare system or provider and like everyone else, you want to access your electronic health records or medical information, even using your iPhone, and people are using iPhones. I know Epic has it out there. All the big vendors have mobile systems out there now. Even that, just because you're on your iPhone doesn't mean it's safe. And Phil, one thing I always heard is that iPhones were basically always built in with standard encryption, robust encryption. Did this zero-click hack of Pegasus Spyware, did it somehow bypass that, or how did that work?
Sure. So they do have great encryption, certainly as good as any other phone that I'm aware of. But unfortunately, encryption only works to prevent people from accessing your data when it's encrypted. So when you're on your phone and you unlock the phone, at that moment, the data is unencrypted, or it's decrypted, at least the data you're accessing. And that's actually when the zero-click spyware was introduced into people's phones, when they were logged into the phones. And so in that way, it was able to access their decrypted data.
Very scary. So, and in terms of Pegasus in particular, but just to get a sense, even if you're texting, not even sending emails, not even, I heard that this spyware could turn on your microphone, but even text, everything was just, everything was available then to these hackers in what most people until recently thought was one of the more secure. I remember when the FBI was begging people, Apple, to allow it to break into iPhones, and Apple was resisting. And I was thinking, wow, Apple really is like Fort Knox. I think this goes to show you that no system is really perfect, and there's always risk. And not that I want to keep people up at night, but that's why you have to, before you use any product, you have to be aware of, is the vendor putting skin in the game, or are you using it at your own risk? I think, and the general rule is caveat emptor, buyer beware. And when you're paying nothing for something, and a free app, especially beware, because very rarely do the vendors in those situations, in my experience, give you any real warranties or assurances, Phil. Are you finding the same thing?
Yes, I think that's a very good point. Obviously, if you're getting apps for free, you have very little negotiating leverage.
Yeah. So some of the takeaways, realize, no IT system is perfect, and think about something, especially for the healthcare providers, before you start putting data out there and you're dealing with a whole new level of risk. Not just talking about your personal emails, you don't want your personal info out there, your credit rating, all that other stuff. But if you're dealing with patient information through an app, that you always have to really think it through, because those fines can be significant, and Office of Civil Rights, OCR investigations can be significant and expensive. So I guess that's the moral of the story. No system is perfect. You really have to be aware of your legal terms and conditions before using them. But Phil, thank you so much for today, and maybe one of our next podcasts will follow up on some of these appropriate data security terms and appropriate limitations of liability. I think that would be helpful.
Indeed. Thank you.
Have a good day. Bye.